What's going on, guys? Welcome back to W.D.Y.D CSP. What do you do as a central sterile processor? Guys, we're going back to basics in the prep and pack side with mouth gags. Now, I have three familiar mouth gags here with me. I have the McIver mouth gag, the Molt, and many of you guys know this as the Davis mouth gag or the Crow Davis mouth gag. One thing in common with all three of these mouth gags is that they all have some type of silicone insert or protector that is used with it. For this mouth gag here, it is this little pad right here, and in decon, this should have came off when it came over into the prep and pack side. Now you want to inspect the little spring load there where the blade gets held on, and there's two little screws there. Make sure those screws are there and that they're tight, that they're not backing out. So it's a little nut and a little screw on one side. Make sure that spring is active. The blade, slide it on. Make sure that the blade is held in place nicely and can be adjusted, and it should have came back with the blade, right? Now, a word on the inserts. If they were discarded or removed in decon, and these are reusable silicone pads. So again, your policy has to stay how often you replace them. In my opinion, they should be replaced every single time. But these need to be put on in the assembly area, right? This would be very difficult and is very difficult to do in the sterile field. So, and they're very easy to put on actually here in assembly. You just put them in. Sometimes you might need a tool to place the item in there or put a little pressure in there, right? And the reason why I say this is hard in the sterile field is because they can create a hole in the glove, right? But here we can do this effortlessly. Place them on there before sterilization. Make sure you're inspecting them well. And if you're placing new ones, they should be clean, right? All right, the Molt has a little tension screw there. Make sure that that tension screw is in place and not backed out. The little spring load there, make sure the spring load actually works and you can open and close the device. There's a spring plate there with a little screw. Make sure there's no damage. Use your magnification to inspect the instrument for any bioburden or debris. And again, silicones, reusable considered, many of them. If they're being reused, please make sure that they're taken off in decon and sent through. And then place them on in the prep and pack side. Sometimes you need a little bit of sterile water to help guide this in. And remember, during the sterilization cycle, they're going to tighten up a little bit. So placing them on in the assembly side is recommended. Help our customers out, ensuring them that they can do the procedure with minimal effort there. Okay, so this is the Molt mouth gag. Make sure everything's functioning. Lastly is this McIver. Now this McIver, I have a great opinion about this with the silicone. This thing, even though again it is reusable, we cannot take it off in the decon side, and that poses a significant amount of issues where there be water, there can be soil, enzymatic trapped in there that we can't fully rinse. And the only way to take that off is those two little screws, right? It can be removed, and it is a part that we can reorder. And in my opinion, we should be removing them and replacing them frequently. Whether we're going to reuse it, we should have a limitation of use, right? But that's hard to track. So I actually recommend that we remove and replace them every single time. Now over in the prep and pack side, you definitely want to use some magnification to inspect this, because as I stated, there can be some debris trapped between that silicone insert and that metal bar. This also uses a blade. Make sure that the spring loader clamp works and that the blades are held in place correctly. Check that little screw. And then check your policy with what that silicone insert is going to be, how often that's going to be replaced. A lot of times we look at our vendors to help us out with this, because they'll place the correct amount of tension on those screws to keep that bar in place. We may not, and it can fall into a patient and cause bigger issues. In this groove here, I didn't state in the Davis, but here in the McIver, that groove, inspect that for cleanliness as well. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself, and until next time, peace out.